Hi, my name is Nicole and I'm a fourth-year medical student from Duke University. Today, I'm excited to present my poster on the implementation of a post-operative opioid calculator. As many of us are aware, the opioid epidemic is an ongoing problem in this country, one that has unfortunately continued to worsen during the COVID pandemic. While often good-intentioned, the overprescription of opioids following surgery fuels this crisis. Despite this problem, providers rarely have access to evidence-based tools to guide post-operative prescription. The Gynecologic Oncology Post-operative Opioid Predictive Calculator, also known as GOPOP, is a validated model that uses 7 patient factors to generate a predicted number of pills a patient is expected to need following surgery. Despite having a validated model, we faced a big challenge in integrating this new tool into clinical practice. We partnered with the Duke Institute for Health Innovation to make the GOPOP algorithm into a mobile app, allowing for the predictive information to be easily accessible to prescribing providers. The app automatically pulls patient information from the health record and generates a predicted number of pills that patient would be expected to need. And you can see an example of what the interface looks like here. To make the app usable, we need to ensure that all of the information GOPOP needs to work is properly incorporated into the preoperative teaching and documentation. In particular, questions about pre-op anxiety and anticipated need for pain medication have to be asked at pre-op visits. To understand the impact of GOPOP on prescription patterns, we also needed to document its use at discharge. This was facilitated by creating templates within the EHR and conducting multiple teaching sessions with anyone who was expected to utilize the app. Once the app was complete, we introduced its use into clinical practice via a quality improvement initiative. We evaluated the success of implementation using 3 metrics, which were 1, the rate of pre-op question documentation, 2, the rate of documentation of GOPOP in the discharge summary, and 3, the utilization of GOPOP in the post-operative prescribing. We also looked at the number of pills prescribed pre- and post-implementation of the GOPOP app. We found that over a 4-month period, GOPOP was used in just under a third of our patients. Both documentation of preoperative questions and the utilization of GOPOP increased from the first to last months of the study. Also, when evaluating the average number of pills prescribed pre- and post-implementation, we saw a decrease from 15 to 10 pills. In conclusion, we found that while implementing GOPOP was challenging and took time to work into clinical practice, it was overall successful in decreasing the number of opioids we were prescribing as a practice. In the future, we're excited about the potential of integrating this calculator directly into the medical record to help streamline the process even further. Thank you so much for listening.